If you have questions about genital herpes and you're really getting confused by what you read online, you're not alone. Let me break it down for you. Herpes is a virus, and it's in the same family of viruses that causes chickenpox and shingles and Epstein-Barr. Herpes has two types that can infect the genitals. Type 1, which is normally found around the mouth and the nose, and type 2, which is normally found around the genitals. However, with oral sex, people with oral herpes can transmit it to the genitals. And if that happens, the first outbreak can be very, very painful, causing a lot of symptoms. Type 1 herpes, that typically is around the mouth and the nose, is present in about 60 to 80% of all people worldwide. And many people have no symptoms, but they can shed the virus from their mouth or their nose without symptoms. And so many people acquire type 1 herpes from their family members, from hugging and kissing in a non-sexual way. When somebody has type 1 herpes around their mouth and their nose, they get cold sores pretty often. I get them if I'm out in the sun too much or if I'm under a lot of stress. And for type 1 herpes, there's treatments. We use antivirals, something like acyclovir or valacyclovir or famciclovir. All of these work directly on the virus and help them from replicating. The herpes virus, though, it always lives in our body. It lives around our spinal cord. And oftentimes it will travel along our nerve roots and come to the same general area and cause an outbreak. So we can't cure herpes, but we can treat the symptoms. And so oftentimes if I know that I'm going to be on television, I will take my valacyclovir a couple of days ahead, like 5 days ahead, to prevent an outbreak. And I don't work for anybody who makes any of these antivirals. I just want to make sure you get the right information. Type 1 herpes can be transmitted to the genitals, and a person does not have to have any symptoms to transmit it to a partner. When people get type 1 herpes around their genitals, they will often have a very severe first outbreak. They may not be able to urinate. They may have sores. They may see a lot of pus. They may not even be able to sit down. It can be very, very painful. Typically, type 1 herpes, if it infects the genitals, will only recur or have more outbreaks once every 4 to 5 years. So a person will have a really bad first outbreak and then not notice anything for many, many years to come. If someone's having type 1 herpes in their genitals, they can still pass that to a partner through sexual contact. How do you know if it's type 1 or type 2? In the past, we used to use cultures, but they were not very reliable. They were about 50% inaccurate. Now we use something called PCR, or polymerase chain reaction. So if somebody has a lesion, it can be swabbed and sent out for a PCR, which is a lot more accurate than the old cultures were. But what about when someone has no symptoms? Then how do you know? Well, there's a blood test that can be done, and this blood test looks for a type of glycoprotein that's bound to the immunoglobulin IgG. For sake of simplicity, it's called the herpes select test. So this is a blood test, and it's highly accurate, and it can determine if someone has type 1, type 2, or both types of herpes. And so if you're concerned about it, ask your health care provider for the herpes select, which is a ELISA test. So why would you want to have that kind of information? Well, you may want to know if you have type 1 and you could transmit it to a partner if you're having oral sex. You may want to know if it's type 2, if you're going to look forward to many more outbreaks around your genitals, because type 2, which is normally found in the boxer short area of our body, any place on our body that can be covered with a boxer short, can shed the herpes virus, type 2, and it can also cause transmission. Type 2 genital herpes recurs on average 4 to 6 times a year, but not everyone has recurrences and not everyone has symptoms. But people can shed the virus from their skin to a partner, and that's what we think causes most of the transmission. People aren't knowingly trying to transmit herpes to someone else, but it can be passed just from skin to skin contact. So what do you do if you have type 2 herpes? Well, you can prevent those outbreaks by taking the antivirals every single day, and that can help prevent recurrences. Also, if you take an antiviral and you're on it for at least 5 days before sexual activity, it reduces the asymptomatic shedding or the transmission of the virus through your skin to a partner. If you're using an antiviral and you use condoms, the likelihood of shedding the virus and transmitting it to a partner is much, much lower. Remember, there's no such thing as 100% safe sex, right? You can wrap yourself in saran wrap and be with a partner, and it's possible, although very, very unlikely, it's possible to transmit something to them. But you want to do the best you can to protect yourself and your partners. So if you're having any outbreaks, or maybe you've been told that you have type 1 or type 2 herpes, go back and look at your records if possible. See if you had the correct testing, because those other tests in the past may have been inaccurate. But if you're having a lot of outbreaks around your genitalia, and it comes and it goes, and all the lesions clear up and then goes away for a while, then it's likely that it could be type 2 herpes. And if so, then I would highly recommend talking to your health care provider about getting an antiviral medication to not only prevent outbreaks, but also to help prevent transmission to a partner. I hope this has been really helpful for you. If you have any comments, please leave them below. If it's been helpful, please click on the like and subscribe to all these videos, and I'll bring some more back to you later. You can always put suggestions in for what you'd like to know about. Take care and be well.